the hangout time is almost longer than the run.
Of course,
Right. It's just like, let's go run for 30 minutes and then go hang out and drink coffee.
For an hour.
Right, for an hour, right.
Danny Matta here with PT Biz, and we're in Roswell, Georgia, checking out Joel Eaby's clinic called Mission Move Physical Therapy. Super excited to see his space, show it off to you. He's got some really unique stuff going on in there that you can hopefully model in your own practice as well. So come on in, let's check it out. What's up, Joel?
What's up? How you doing?
How's it going, man?
Yeah, it's good to see you.
Good to see you too. You might be the most longest tenured cash practice owner that I know. How long have you had the practice?
It'll be 16 years. 16 years in May. Yep.
And you started it right next door, right?
Right. Yep, 2 doors down.
Okay, you gotta tell a story about how you got connected with the gym owner and how you actually started your practice. It's one of the more interesting ways that I've heard somebody start a practice.
Yeah, so it was crazy. It was 2008. Things were slowing down with the business. I had pediatric home care, and I wanted to get into the gym PT world. And so I kind of was like looking for a place to open a practice. And I saw a guy posted an ad on Craigslist, and he was like, hey, I have a gym. I'm looking for a PT to be in my gym. And I thought, that's kind of cool. Like, I never really heard of that, right? Yeah. And so, I went and met him, and he was a cool guy, and I was like, we should try this. And he was like, yeah, let's see if it works. But yeah, just a Craigslist ad. That's all it was. That's all it was.
What is it about this area that you like, that you think serves a practice like this well?
Yeah, so this area is sort of the area where schools are really good. So this is where people move to when they're getting ready to have kids and start a family, right? So it's not the place filled with a lot of young singles, I would say, but with a lot of people who, this is where they're starting a family, and so they have a lot of connections in the area. So again, it's that really active adult population that we like to serve. Yeah, so I would say our avatar, the average patient we come into, is somebody who's like, kids are probably in high school, right? They're having to have a little bit more time for themselves, right? They kind of got through that early stage of their career, and so they're like, I have a little more time for myself, and like, I used to do these kind of things, so I'm going to get back in. I want to play more tennis. I want to play more golf. I want to become a runner. I always wanted to run a half marathon, something like that. So they get a little bit more into their sports, and that's sort of where we're at.
Tell me, why did you name it Mission Move? Like, what is it about that resonated with you?
Yeah, so I kind of had someone help me with like naming it, right? Like I was like, I actually rebranded from something else a little while ago. And so I was like, it was North Point, right? Which is kind of just a common name in the area. There's like a North Point Parkway that's nearby. So I wanted to rebrand. And so this guy who helped me, he's like, think about, what is your purpose, right? And like, what is the outcome of that purpose, right? Like, what are you trying to do, and what is the outcome? And I'm like thinking, all right, well, at the end of the day, like when I thought through it a whole bunch of times, it's like, we're trying to get people to move more, right? Just that's what it is. So it's like, and if that's what we're trying to do, and then it's like, that's the purpose, and I guess that's our mission too, is like, so it's like, all right, that kind of flows together. It's like mission move. Yeah. And so, yeah, that's kind of how it came to be.
I like it. Yeah, it definitely makes a lot of sense. Okay, so this space, how long have you been in this space?
I've been in this space 3 years.
3 years, okay.
Yep.
And how big is this space?
1,500 square feet.
Okay. And this is it's like a sort of an open closed model. Like it's a bit more open. Yeah. You obviously have the gym, 2 offices then, right? So 2 treatment offices. So let's check these suckers out.
This was just one wide open space. And so I thought, I need a little bit of privacy, but I didn't want to have to build out rooms because I wanted to kind of be open. And so, we just put up these walls, and then we just have the curtains, right? If you need to do some dry needling, or just someone needs a little bit of privacy, you can always close the curtain. But other than that, it seems it's just more open, right? And that's good. Sometimes it gets a little loud, but it's always nice to, you can hear somebody say something funny and the whole room laughs, right?
What would you say? I'm interested. What's the most overrated thing that you think people think is important, but is really not? And like, what's the most underrated thing as far as treating patients?
People think it's the exercises. It's probably the most overrated thing, right? Like, it's just like, well, as far as like that, I've got to do like a whole bunch of exercises, right? Like, as if like, give me a whole bunch of stuff to do. And I'm like, no, we just want you to do 1 or 2 things really, really well.
The right things,
the right things really, really well. Understand why you're doing them. Make sure that you feel that they're working and things like that. And having them have that understanding is really important. Like that, and that's probably the part that's underrated, right? Like, you've got to have your patients on board. And I've even explained to people, there's some exercises that it's just hard to feel. Like, and patients won't get buy-in from them. Like, don't do those, right? Yeah. They just won't. So, but yeah, it's funny. People are looking. They're looking for some sort of trick, right? Yeah. Like some sort of technique or some sort of hack or whatever. I'm like, nah. You know what? It's basically like, just letting things calm down a little bit, progressing forward, right? We call it graded exposure, just exposing a couple of things, let your body heal itself.
Right.
And just move forward.
Yeah.
And it's not magic, right?
Yeah. Well, let's look at the bike fit. I'm interested because this is one of those that we actually haven't seen a practice that had a bike fit station in it just yet. So tell me a little bit about the equipment and we can walk through kind of what a bike fit looks like.
Yeah. So this is called a Wahoo kicker, and it's basically like I take the back wheel off the person's bike and set them on here, and then this is plugged in, and then we plug it into an app actually on my iPad, and then I can control the resistance of it, right? So if I wanted them to feel like what it feels like to ride uphill, I could make them ride uphill, make it easy, make them, just have a lot of resistance and to simulate their riding, right? So that's really important that the person feels like they're actually riding their bike when they're in here. And so, we actually go in here, adjust the bike. It's about a 2-hour appointment actually. And
that's a long time.
Yeah, it can be a long time. So we'll actually do, and this is a big difference with having a PT do it, we'll do a little bit of a PT exam first, right?
Yeah, sure.
Because it's people come in for a bike fit just like they would a running assessment, I'm having some issues.
Yeah.
That's why they're getting it a lot of times, not always. And then we basically look at their bodies, maybe you're something going on with your body that's part of why you're not comfortable. So we narrow that out, go through that first. Then now let's get you on the bike, see what component of that is, and we can kind of blend the two together.
All right, let's finish with your coffee station, because what I like about it, and we'll cut some shots of your what was the workshop that you did? It was like a runner's latte workshop or something like that?
So I know a lot of running groups in the area, so it's just one of those things where it's sort of like, hey, they will sometimes meet at coffee shops. So it's why don't you meet here?
Yeah.
And then we'll do the run and we'll come back. I'll cut the run short so I can come back, get the machine all warmed up. And then, they just hang out, and it's they'll hang out for the hangout time's almost longer than the run. Right. It's just let's go run for 30 minutes and then go hang out and drink coffee.
For an hour.
Right, for an hour, right. So it's I'm in here making coffee for 20 minutes and stuff. It's just cool. It's just a way to if community and stuff. And then, the other way we utilize the coffee is just who doesn't like coffee? And so morning patients know that, if I show up early or even say on our website, hey, ping me. If you want a coffee, let me know. Text me 10 minutes early. I'll make something for you if I can. And then the employees know, and they'll be like, hey, Joel, are you doing anything right now? So-and-so wants a cup of coffee. They want a cappuccino. I saw your machine back there. And I'll be like, all right, let's do it.
It's just a community side. I think what's so smart, maybe not everybody, has the skill set of being able to make a really good cup of coffee. But I feel like having something in your practice, even for us, we have people stop by just to hang out with our front desk. Or to have her make them a cup of coffee, because we sent her to barista training, I was telling you, right? I think having an espresso machine, the smell is great. It's who doesn't like that, especially if you can come at them with a really good cup of coffee that's maybe they're expecting a Keurig cup, and you give them something awesome. They're like, oh my gosh, what is going on? But it's just a little thing you can do to make this feel different, you know? And I think that's just across the board what we've seen. I think you've done a really good job of that, both with this and how you're connecting with the community, the bike fit stuff, just the way the space looks. It's obvious that it's just really, it means a lot to you. A lot of your personality's in it, which is awesome. That's one of the things we like the most about it. So I'm interested though, for you at this point, what's it look like for you 5 years from now? You've been in the profession now for over 20 years. And obviously you still are treating patients, you still like it, but where do you want to be 5 years from now with Mission Move? What does a home run look like for you at that point?
You ask kind of if what's missing in the space that you would like, right? And so again, it's when you get in more active clientele where you want to see them maybe run or push a sled or something, we don't have a lot of space here for that. So that's where it's I came from a gym where I did have that space, right? And then you kind of make it smaller and you make it more, it's not super loud and noisy and, crazy music blaring. So you can kind of make it a more of a niche kind of clean space, right? But now it's man, I kind of want some of that back, right? So 5 years from now, that would be great, where it'd be sort of can we have a little bit bigger space, a little bit turf area where we can work with get more athletic people doing stuff, right? And then I almost envision it as sort of like a private side and a gym side, right? And there be a division there, right? Where it's sort of you could have doors in between it, right? So it's almost here's the more office side where we do the evals, maybe have some pelvic floor, maybe have some massage therapists, right, on that private side.
Yeah.
But then over here is like party side, the gym side, right? And that's where, right? And so that's where the noise and all that stuff. So to try to have the best of both worlds of like a gym PT, but have that little division there where you can have two sides of the business almost.
I like that.
That's kind of the 5.
I like it. That's a great idea. I think that's a really good model. If you're watching this, totally steal that idea, build it out, because we need more spaces like that. I think we need spaces where people can come, they can go from being hurt to not hurt, and then they can move over to being more fit than whenever they came in, right? So for whatever the goals are that they have. It could be just keeping up with their grandkids. It could be cycling at a competitive level. It could be playing tennis. It could be whatever they want, right? It's just like being a better human being physically. That's it. And then I think for us, what's interesting is you have such great buy-in with people and trust. You're just taken from a pain state. To be able to move them over there, and whether that's, you have trainers doing that or it's, clinicians, whatever, it's kind of up to the person what they want to do. But I think that natural continuum makes a ton of sense. So I'm excited to see what it looks like. Maybe we can pop out a wall. I don't know.
Yeah, exactly.
What's next?
Well, there's a hair salon. It's been there forever.
Oh,
and I joked, I was like, I'm
business.
gonna release some cockroaches under the door or something, right? Get them to leave. Because I've even asked my landlord or like my real estate. It's like, ask about that place. We just move them out. Be perfect. I'm already next door.
Maybe they're growing. And they want to expand too. You never know. I don't know. But that'd be cool. It'd be cool to look back here in a few years and see what it looks like in comparison to what we talked about. But that's it. Thank you so much for watching. Joel, we appreciate your time and how busy you are. I hope you guys like this one. And as always, thanks for watching, and we'll catch you on the next one.